Thank you very much, everybody. And as you'll be aware, the Northern Ireland Statistics and Research Agency has today published more information about the devastating impact that COVID-19 is having on our society. And NISRA have revealed that 157 people passed away from COVID-19 related deaths in Northern Ireland in the period leading up to the 10th of April. That's a lot of heartache for people to bear, and every death has robbed families of friends and of an individual who was cherished. And our thoughts are with you if you've been left behind and been asked to grieve in circumstances that just don't feel right or fair. The Deputy First Minister and I know you've had to endure a lot of pain, and we want you to know that this executive will do all that we can to support you in this toughest of times. Each death is keenly felt too by our carers in nursing homes, the domiciliary sector and our hospitals. And as an executive, we are especially aware of the mental health toll that there can be on carers, which is why it is important that they access the psychological support that the Health Minister announced yesterday. It is okay to say you are not okay. You are being asked to care for people in the toughest of circumstances, and you will experience immense sadness. And if you need to talk, please do. Over the last few weeks, a lot has been asked of us as a society, and everyone has had to fundamentally change the way that they live. Once again, it is worth putting on the record that this executive is very thankful to the vast majority of you who have adhered to the public health advice. By staying at home as much as possible, by social distancing and self-isolating, by restricting what you do in public and observing the 2-metre distancing rule when you're at the shops, work or exercising, by rigorously washing your hands, you are limiting the spread of this disease and you are preventing it from overwhelming our healthcare system. Now, there is no doubt that our awareness campaign across a range of media, along with the public messaging, is having a positive impact. And all of this is good, but we cannot relax our guard. COVID-19 is an invisible killer that thrives when there are gatherings of people, and we all need to resist the temptation to see family and friends, and we must stick to self-isolation and social distancing guidelines. So as I keep saying, as others keep saying, this really is a matter of life and death. It is, however, also important to remember that these restrictions are only temporary. We will return to something resembling normality, and school corridors will eventually bustle again, and restaurants and bars and sports grounds and concert halls and theatres will entertain once more. And as an executive, we are considering what a path back to normality will look like. We are going to develop our recovery plan, and the Deputy First Minister and I will meet with the head of the Civil Service early next week to make progress on that. Many sectors have been heavily impacted. Those on lists for hospital appointments and treatments have seen their waits extended. And our economy, of course, has taken a massive hit. We need to ensure our businesses are in a strong position as possible to stabilise and to rebuild in the months and years to come. We will continue to work closely with business. We hear the calls around what can make a difference in terms of business rates and other issues, and the executive will do all that they can in order to assist. Change around the broader societal interventions the executive has had to make is going to need to be very delicately handled, and our response will be a graduated one. And given this may be only the first wave of this pandemic and no vaccine is as yet readily available, we will be very much guided by science and the experience of other parts of the globe where they have relaxed their restrictions. We will engage stakeholders in discussions on how we handle this as the initial threat recedes. But as we head into the weekend and face at least 3 more weeks of these restrictions, it is essential that we remain focused on the immediate task of flattening and reducing the current rate of infection. As a society, we've done really well to prevent our hospitals from becoming overwhelmed by COVID-19 cases, but let us not become complacent. Please stay at home as much as possible and please help our health workers to weather this storm.